Thank you, Wellington, for inviting me to offer an opinion about your NFL lineman who has minimal neck pain and a defect in his C1 vertebra. This is also known as C1 spondyloschisis or a bipartite atlas. This really occurs because of failure to form of the two growth centers of the atlas and usually involves a minimal defect posteriorly and a fibrous union anteriorly, usually easily differentiated from an acute Jefferson's fracture. People have classified types of atlas failures to unite, and most of these involve failure of the posterior arch. And we should differentiate spondyloschisis from hypoplasia, which can be unstable. When I've seen an athlete in the office and deciding return to play, I look at the age of the athlete, the sport they're playing, what position they play in that sport, what level of competition they're at, high school, college, or professional. Is their body habitus appropriate for their sport? And what are their symptoms? Interestingly, when Wellington presented this case to me, it's in contrast to a patient I just saw several months ago who was a high school football defensive back. And there's really different factors to consider. In the case presented today, this is a professional lineman with minimal symptoms, a long history of high-level performance in college and in the NFL, which is a type of stress test. And he's a large man with a muscular build. He has a professional contract, and he has disability insurance. A high school player that comes to see me was hoping for a soccer scholarship, not football. He has a slight build, and it's unlikely that he'll play professionally in any sport. His imaging showed smooth contours of the defect, which are consistent with a fibrous union of a bipartite atlas, not an acute fracture. On an MRI scan, if you look carefully, you can see that his transverse ligament is completely intact, as is the apical ligament. And I think that helps us determine that this is a stable situation. We can confirm that with flexion extension films, which show no abnormal motion between the occiput C1 or C2. And finally, on a coronal view of a CAT scan, you can see that there's minimal splaying of the facets at C1, C2, indicative of a stable alignment. If you review the literature on bipartite atlas, it's of no help. There's a few case reports, but there's not a single case of a catastrophic injury from this condition. What did I tell my patient in the office? I told him he cannot finish out the football season since he was already a senior, but I did clear him for competitive soccer in the spring. With this patient from the NFL, I would certainly clear him for return to play. He's already battle tested this in previous seasons. And if his coach and his agent disagree that these are all things in his favor, I think he can safely return to his sport. Thanks so much for the opportunity to offer this opinion.